Mm. Alright, now like I keep telling you though, if you have a weird injury, the only thing you can really do is compare it to other injuries, right? Somewhat. Well, let's look at the neck next, right? We're trying to figure out if I have a neck injury and when it happened, it was that direct fall, whatever, right? And did Jesus heal it somewhat too, right? How did he heal it? If he healed it, right? What was healed and what wasn't healed up to this point too, right? Because whatever happened started with the rat. But in the hospital less than 2 days. And something blacked me out there. Normally that don't happen because the seatbelt, even if the windshield collapses on your head, is somewhat to protect you. And David Pelham said I was wearing the seatbelt. So, uh-oh. Does that involve him and Johnny and Sheriff Norris? I don't know. They at least showed up to direct. That's what I mean. That's what you mean. They're witnesses, one way or the other. uh-huh. Now, the other question is why? What was going on? Did something happen before? And uh-huh. Uh-huh. And did they try to attack me over Johnny's problem with dating Lynn or what? And see, it's his problem if he's dating a woman he don't want to be dating and then acting all weird about it when people talk about it. Right? So that would be, and if you're really dating someone, it's not a rumor where it's not really happening. Like I said, and even I have a rumor that I'm gay, but I'm dating women. So what you want? What you want? I got a girlfriend. I meet girlfriends at the river every year. Something I would tell them too. I'm trying to find a girlfriend, like I said. Right now, I might be trying to wait for marriage type situation. I heard of that too. When I'm a teen, because I don't want to knock up a girl and get her pregnant and have to raise a baby from my teens on. Now, I'm a little tempted to have sex, but most of the girls I'm with don't want to go all the way yet. Lisa calls it her dad, and like I said, other girls I'm just not sure if they want to go all the way, and if they say no in an odd way, I'll just stop. I just don't. Or they, act to sleep, I won't go through with it. I won't even start really. Right. Like I said, and I also don't know if the guy didn't fill out an incident report of what he witnessed, right? With public suit, right? He could have. As a good type Samaritan, he tried to help me get up too. I know. And there are no signs out. No. When it's raining, you got to put signs up for your. I know. Right? I know. But do that next time. Next time. Mm-hmm. Mm-hmm. Well, like I told you, we got a lot of CDs here anyway. Mm-hmm. Now, I saw a blonde female in the back I liked. And again, another blonde female came in as a customer at Burger King yesterday. But I think the guy who's got the long hair is acting a little funny. Needs to stop, please. Not to embarrass him or anything. I don't think he's listening to me, but to someone else. Or his own little issue with that. But like I said, I'm your friend if you're gay or having those kind of feelings. I don't do that myself, right? And you can't change my feelings Nor if you like me do I have a problem with it, but I'm trying to let you know I'm not really into being with a guy. That's all. That's all. Hmm. Now, if you are, that's up to you. That's between you and another guy. Mm-hmm. 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 Now, different women want different things, right? Too. Mm-hmm. So, this morning, I went for kind of a brunch. Had some eggs, bacon this morning. Mm-hmm. Had some green beans and hamburger steak. Mm-hmm. With gravy. Mm-hmm. Had some baked potato and two pancakes, which I ate about three-fourths of that. Mm-hmm. Maybe a little less. Mm-hmm. And that was my dinner brunch this morning, right? So didn't have really anything happen at the Huddle House. Kind of a cute blonde, right? She kind of has a shamrock on the back of her right ear. Kind of checked her out a little bit, but behaved. And like I said, right, not trying to start nothing with her. Don't know her situation. She can be in a relationship, things like that first, right? So I don't know. Mm-hmm. But she was attractive, and I was checking her butt out a little bit. That's all. That's all. Mm-hmm. Mm-hmm. I think one of the uh, her co-workers that was a guy kind of noticed it, so I'm kind of mention it too. Kind of. Mm-hmm. She had kind of brown eyes with blonde hair. Mm-hmm. Dyed or not, don't matter. But anyway, mm-hmm. So after I got done eating, I went to Walmart and bought a few things. Mm-hmm. Tried to buy some clothes and some milk on my card, but it didn't go through for some reason. I just paid $300 on it. Kind of weird there. Like I said, I'm trying to pay down the debt a little bit, but also might need a few things until next month, right? Mm-hmm. 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 Well, see, it can't be a fake dating site. That's the problem. You have to have real people on it. You can't upload pictures of other people who aren't really on your dating site. If you're offering me an exchange, you gotta be specific in what the exchange is too. If it's not sex, masturbation with the woman ain't sex. And with the woman, they're two different things, right? And yeah, then you're being delusional about what sex is. I know what sex is. I know what masturbation is. I know what a blowjob is. I know what all that is. I know what a hand job is. Right? But guess where I learned all that? In the Navy. Right. And I try to make people laugh. Just take it off. Just take it off. But like he said, he's telling the truth too. Had a couple comments still. Yeah. But that's what you do. If you can explain what you're doing and it makes sense, it's either a made up story, it never happened, or if it did happen, you were doing something legal. Mm-hmm. With the girl, too. Mm-hmm. As a step parent, right? Not illegal, not illegal. The right art of the. What? Mm-hmm. I'm sorry, the computer's got a lot of viruses on it, so it's slow. That's also how they hack you. Mm-hmm. That's why I show you're hacking. I could even be watching me, but I think the camera lights up unless they figured out a way to do it differently. But like I said, right. That's why I also walk around naked a couple times just in case. So they don't do that, so they don't do that. If they can do that. Mm-hmm. And also, if you ain't got nothing to really hide, you ain't got nothing to really hide. Self-righteous male jackass like I'm sleeping with the enemy, I don't need your ass. Critiquing me like you know anything. But what a demon knows. A demon wants a clean house when he takes it over. Disabled veteran might have a disarrayed house. There's a difference, right? But see, if a female comes home, she already knows what she's getting into. I ain't had nothing. Mm-hmm. But she knows why, too. My ass is hurting right now. I literally have a broken ass, not like the guy in Scrubs. You're like the guy in Scrubs. You don't have a broken ass. I do. I do. And I'm lucky to be walking on it by the grace of God. And I'm thankful for the arthritic pain because this proves Jesus is trying to heal it. Now, I'm sorry, but Christians, if you're not getting real miracles in your church, you're doing something wrong. You're doing something wrong. You're not teaching what you're supposed to be teaching. Hate to say it that way, but yeah. I don't know. Mm-hmm. Sometimes it could be just a person believing it. Mm-hmm. Right. Temporarily, but then they lose faith again, right? See, if you seek the devil, you'll find him. And if you seek God, you'll find him. But it's easier to seek the devil and think he's God. Oh. Mm-hmm. Right. Mm-hmm. We're more closer to the devil now than God and Jesus. Trust me. Mm-hmm. But you still gotta help me with the current case, I know. Even if I'm kind of ruining it a little, I guess. You think they're watching my videos too? I don't know. I know you don't know. Probably not. Probably not. Mm-hmm. 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 But first we do a normal x-ray and find out what it looks like if it's injured, right? Too.
We're going to look at the
So this
cervical
is
spine
the
anatomy
Dr.
via
Donald
X-ray. In general, for a
Corn
cervical spine, there are two views to be taken. The front to
MD
back view and the
SC
side view.
DC.
They're represented on the screen here by that view right there and by the side view
Alright, go
here.
up, crazy.
On the front to back view, you can see how the vertebrae line up one on top of another. You can look at these little tiny triangular processes called the uncovertebral joints, and that can tell you something about the health of the vertebra. And on the side view again, you see the base of the skull, you can see the jaw, you can see the individual vertebra, and then you can see where the discs are in between the vertebra. The discs, of course, don't show up because there's no bone in the disc, but you can actually see the disc height and get a general idea of the welfare of the disc. You can look in the back part of the spine here and see the facets. This is also the canal where the spinal cord lives in through here. And these are the spinous processes that project out the back that you can palpate by simply putting your fingers on the back of your neck.
Speak for yourself of what I can handle and what you can't handle. No. Because obviously I'm still upright and standing, right? Because of the man he healed that was laid prone, right? I know that. Now I have no real pain in the neck still either. This is the spinal trauma,
So this lecture will be discussing
cervical
spinal
trauma protocol, control spinal fracture,
can play a key role
radiology,
it can help you exclude an abnormality that can lead to a long-term complication in the patient's
lecturo medical.
So when a patient comes in with a cervical spine trauma, if there's any kind of suspicion of a spinal fracture, the patient's neck should not be moved because an unstable fracture can compromise spinal cord integrity. So the first thing that's done is a trauma protocol, which involves a cross-table lateral radiograph of the neck. And this ensures that there's no fracture or subluxation of the cervical spine prior to obtaining further imaging, which may involve manipulation of the patient's neck. Common mechanisms of spine trauma include a flexion injury, an extension injury, a rotational injury, or a shearing abnormality. So these are some common spinal fractures. The most common fracture of the spine is a compression fracture. We can also have what's called a burst fracture.
I should at least have a compression fracture of some sort.
Is pushed into the vertebral body below. This can result in a comminuted fracture of the vertebral body, and it's often associated with retropulsion of bony fragments into the spinal canal, which results in an unstable fracture that can cause neurologic deficits. So this is an example of a radiograph and a CT scan that demonstrates a burst
now,
fracture.
see how...
So you can see that there's a...
See, that's the back of the neck. That's the bone. See how close it is? Right. That again, I know.
canal.
I pointed out before.
With
mine, with yours.
To the
How close the bones are to the back. See, that's the muscle, right?
Of fragments. On the CT scan, you can see that there's a fracture of the vertebral body, and the fragment is pushed posteriorly into the spinal canal. There's what's called a chance fracture, and a chance fracture is also called a seatbelt fracture, and it's usually caused by a lap belt in a motor vehicle accident. This is a type of flexion distraction injury, and you have fracture through the vertebral body, the pedicles, and the spinous process. This can actually be associated with an increased interspinous distance, and you have separation of the facet joints.
Well, it depends on how. Obviously, I guess I put my hand in front of the mirror, the window was collapsing on me.
This is associated with abdominal visceral injuries as well.
I would do that either.
So here we have two CT scans, sagittal images, which demonstrate a fracture through the vertebral body and the spinous process. So this is an example of a chance fracture. Often these are associated with an epidural hematoma and possibly a cord contusion as well. So Jefferson fractures are axial loading injuries. You have offset of the lateral masses of C1 with respect to the lateral margins of C2 when you do an open mouth radiograph of the cervical spine. There are also fractures of the anterior and posterior arches of the C1 ring, and this is best seen on a CT scan. Usually, these are not associated with neurological deficits. So let's take a look at this example of a Jefferson fracture. This is what's called an open mouth view, and it demonstrates lateral displacement of the lateral masses in a Jefferson fracture. So here we have lateral displacement of the two masses laterally. When you compare it with the lateral margins of the C2 vertebral body, you can see the prominence of the lateral displacement here. When you compare it with a normal film here, you can see that this is well aligned.
Normal.
So the lateral margins of C1 and the lateral margin of C2 is actually well aligned. While with a Jefferson fracture, it's not, and you see a step off on both sides. On a CT, you can see a fracture involving the anterior and posterior arch of C1. So here we have a fracture involving the anterior arch, and then here we have a fracture involving the posterior arch. So when you're taking a look at a CT and you see a fracture of either the anterior or posterior arch, you want to take a look for a second fracture. Because this is a ring, usually rings fracture in two different places, not just one. So if you see one, you may be missing a subtle second fracture. A hangman's fracture is actually a hyperextension compression injury. So this can occur in patients such as an unrestrained passenger who hits their forehead on a windshield in a motor vehicle accident. This is not truly associated with a judicial hanging, which actually ends up causing hyperextension, resulting in distraction of C2 and C3 and distraction of the cord.
But I would have to be unrestrained. Yeah.
Imaging findings include a fracture of the posterior elements of C2, and the posterior aspect of C2 is actually separated from the anterior aspect of C2. So this results in anterior displacement of C2 on C3. This is actually not usually associated with neurological deficits.
Lot facet.
So this is an example of a hangman's fracture. This is a lateral cervical radiograph which demonstrates posterior displacement of the spinal laminar line. So you can see here the line drawn with a posterior displacement right here, and then again it moves anterior here. The line should actually remain symmetric all the way up and down. You also have anterior displacement of the C2 vertebral body, and you have fracture of the posterior elements of C2.
Uh-oh, because I've had a fracture.
Spinal fractures that you may encounter. Again, these are very important to recognize because they may have chronic neurological deficits associated with them.
Now, am I accusing or just trying to figure out what the freak happened? Right. But who would get mad about it? Someone who actually attacked you and tried to kill you and they didn't succeed, right? Exactly. That's why I'm trying to protect my family and all that shit. I don't know what's going on, right? I know Satan's a murderer too. Right. Right. That's still the lumbar. Mhm. 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 So this is still the sacrum fracture, right? And the pelvic fracture, yeah. And see, that's up too high, like I showed you before. Right. But I do. I have every right. Even if they're wrong. Even if they're wrong. And do my shipmates or some strange man I met down the road, even if I had sex with his daughter or something, have a right to murder me? No. You don't. You might want to pretend murder is legal in America, but it's not. But what do you do? Forgive him, for he knows not what he does. Oops, get through that. Sorry. Big nipple. I didn't know. I'm waiting for the CD to develop. You think? That happens periodically throughout the day. And, too, get to see big titty woman. It's another way to describe the breast in what? In a modern term. It's not a crime. It's not a crime to call them titties or boobies or breast or female chest or male chest. But you do need to be specific. If the word changes, there's a reason John did that. If he changes it from Cephas to Bastois and you're a man, Christ ain't a man or a woman, is he then? He might even be able to morph into one or the other, right? You can't do that. That's why you're not the God of all flesh. Jesus is. You still don't understand that, do you, carnal Christians? Christ is the God of all flesh, not you, man. God's not a man only either. He can become what? Both. Right. He could really be transformingly different. Because he's God. He's God in the flesh. You can't do that. Wonder why. Whoops, another beautiful black woman. Whoops. Just popped up. From nowhere. Puppy. Or Naomi. Naomi. No. There it is. But that's the point. I can be seduced, married woman or not. I'm not necessarily Joseph either. All the time. She would just have to assure me she's sure. But I don't remember every detail. Just in general. Well, I'm not going to suddenly collapse if I see it and realize what happened either. I told you that before too, right? If you've been walking on it since you were 16, you've been walking on it since you were 16. And we're healed like the paralytic man in the Bible as well. The one lowered through the word first. It is a neck injury, right? It's usually. I know, they just pretended it wasn't even there, right? Right. Whatever they saw, they ignored it. They ignored it. I agree. But you can't heal in 2 days because you believe in Jesus. After a car wreck, can you? Okay. Let's not dilly-dally or argue over semantics, but whatever I said that day to heal me worked. Whatever I had to tell the men worked. I know. And some people just don't have the faith yet to be healed like that. But I'm trying to help them. So it's God, right? Through your eyes. That's right. But like I said, right? Mm-hmm. Right. I'm not the one who probably meant to start anything either, but if I saw a pretty girl walking down the road and she was my type, I would go for her. My new car, too. Come my new car. I don't know. Or something happened at Vivian's. I don't know. Right. But whatever happened, I'm trying to forgive it, right? And I'm not trying to get anybody in trouble, not even Johnny, David, or Little Roddy, right? Or Vivian and her daughter, right? If I didn't involve them either. Or my parents, or like I said, but they're in the vicinity, right? But that's what we mean about something crazy would have to happen anyway. For someone to attack me for having sex with someone or not, right? Mm-hmm. Or because they were having sex with an older woman. You don't usually attack someone over that, do you, Johnny? If you're really with her. If you're really with her. Some will say that's, good for you and that's cool, right? You were just having a cougar once in a while. That's the thing. You shouldn't be ashamed of it. If you are, don't do it. Where people can talk about it. Right? Plus, who told me? David? Pelham, your friend? He's the only one I can know it through. I don't know you any other way. We're dating at all. I know. So, really, when David told me someone told you, I told them you were dating Lynn, I didn't even know. Hold on. I'm not afraid of you either. If you're still ashamed of dating Lynn, like I said, why'd you even date her? That's on you and her. And I guess it was reciprocal, right? Sure. You are over 16, so it's not like it's pedophilia or anything for her either. Right? Though it could be, again, if she was with me before I turned 16. Right. Now I found Lynn as an attractive woman too. I even might have mentioned that. If you're trying to confront me over it. Possibly. But it's really going to get out one day, Johnny. Then. Oh no. If you attack me over that bullshit, and I have to call a God Jesus to heal me. And Jitsu be damned, right? It has to be, right? Uh, mm-hmm. I'm just waiting for it to do something. I'm not already. I know most of the time it's trying to get to them X-rays, isn't it? But I ain't changed since yesterday either. I'm not supposed to. I'm not supposed to. Like I said, right? Why are you on about my hair? I know. Looks pretty good for a 51-year-old man. I keep telling you that too. Right? Mm-hmm. And like I said, all that means is this side looks odd to you, and this side looks odd to you because it's a little up higher, but it's not receding. Receding means it goes up a little higher, a little higher, a little higher, and it's the same. Then just shut the data there, to where anyone would know, to where anyone can say anything. They grow up and be a man. Either they do or don't. Okay, cervical spine. Mm-hmm. 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 Well, you know the computer has viruses on it, but that don't mean anything per se, right? It's slow. It's slow. And you know what you did, and I don't. Because you can't let it go. You did that. I survived it. I was out the hospital in 2 days. You made it a miracle, and you made it a miracle. And the doctors couldn't even believe what they were seeing, so they turned a blind eye. Right? That's what it's called. That's what it's called. And I was trying to access the record and hear that little noise, and I guess that's right. It's just being slow. Mm-hmm. Well, you probably don't want them to see it at all. That means the doctors lied about it. That means everybody lied about it, and some people didn't even know about it, right? Too. But somebody did. Somebody did. They knew what they did to me. It's to get you to what? Believe in Jesus and repent. I'm not trying to expose you any more than you could have exposed yourself, by attacking me in the first place and making me call on Jesus too. What did I tell you about that? I know I've mentioned Shadrach, Meshach, and Abednego, whatever is not a faith is sin, right? If I believe they can heal me, though, they can heal me, too. That might be not be typically how people are healed either. We can preach all day too. But you know what the problem is right now? The computer's slow. Yeah, I know. And it's doing something, but it's not doing it quickly enough. And so what can you do? It's being slow. It's being slow. It's not wanting to respond. Well, I don't know what you did. You're thinking again, I'm going to collapse suddenly unless you attack me again and try to do it again? Or are you ready to repent of it? No. That's the point, too. A Christian doesn't not offer you a way out, a way to repent. And if you don't, it's between you and Satan. And they warned you of that too. They warned you of that too. But like I said, then you gotta figure out what the thing's going on and try it all over again, alright? So something gotta happen soon. One way or another, one way or the other. Everybody gets impatient after a while too, right? I know. And even if I have to exit it, right, and then do it all over again, right, I will. Because I know I sinned. But are you ready to repent? See, until you repent of your error, you're still in that error. Whoever it was. It's one thing, again, for me to know something happened to me, but it's another thing for you to know you're the cause and not admit it. Right? Right. Because you tried to force me to die that day, maybe. Did I though? No. No. You're just not a man enough to admit everything you did was wrong. That's all. True man admits his faults and confesses his sin and tries to repent of them and throw himself on the mercy of the court too, right? You can't do more than or less than what you did then either. And all I can offer you there is, again, repentance or forgiveness if you repent, right? Now, I'm not the courts, and there were no charges filed at the time. You do have statutes of limitations as well, unless you're currently attacking me. Then that's different too. Then the current attack can count. Then quit attacking me altogether first. Let 10 years pass. How about that? Right. Let's just see what I mean, right? See, something's messing with everything right, this morning. And it's on the computer, whatever it is. So it's some kind of virus or something like that. That's why I show you in case they want to try and go to kitty porn sites, which I never do. Right. Exactly. Showing you I got viruses on the damn thing, right? That's why it's doing so slow, right? I might eventually, but it's about money too, right? Not that rich, I know. Right. But like I said, if you don't know nothing, you're guessing, right? Guess ain't a crime, right? But what is one? Is one. Right. Because obviously it's recording. It's recording time, right? Well, yes, the X-rays are what we should look at first. Well, like I said, this happened 30-something years ago. 86. tonight, 2020. Mm-hmm. And that was before Keanu Reeves even made it on the big screen. It was. Now Stephen King had his little book out. I was in the hospital 2 days. It's different than yours. How long was he there? Several years, right? Difference. And it's my real life. Yours is fictional, remember? It ain't even remotely the same. And mine might have involved an actual physical attack of somebody. Because I blacked out. You don't normally black out. Mm-hmm. There it is. Mm-hmm. Oops. Daisy with her legs all over her head. Can't see that either. But why? Because you're ashamed we have sex with each other too. Wonder who's that from? Satan too, right? Well, they did something that was natural in Eden. Something that was obscure with Satan in day 7. You figure out what we're doing today that might be considered one or the other. One sex might be considered natural. One sex might be considered obscure. If you don't know which that is, all I can say is you gotta figure it out for yourself. Right. Mm-hmm. Mm-hmm. Alright, I'm gonna start here, right? So you see, right? That's a human structure right there. Oops. Sorry, it showed you the booty butt from behind. But why do you think it's happening? A, I'm subscribed to the dating sites. And B, it's just popping up. See right in there? Right. That's the C2 and C3. These are the facets, right? And a slot at the C2 and C3 right there, right? That's where the fracture would be for the fracture, right? We already told you that. Yep. Exactly. You still see it, right? Right. No. I guess that's for Judas or something. And Simon, his father. Did he draw the lot, Simon? Did he draw the short stick, as they say? And just as much. Mm-hmm. I know. But a bat, maybe. Can cause it to look like a compression aiming stretcher. And two. Right. See right in there. Nowhere near an alignment. Right. See, right. See that there, right? Right in there, right? I know. That's crushed. Down on it, right? But see, they could have attacked me similarly at the fall, and it wouldn't have mattered because of the car wreck. And I would tell them that too. I know. And see, this one's down. See that big gap down, right? How's it supposed to be? Up. That's crushed. How? Down, right? It's supposed to be up. It's supposed to be up. Right. You saw that too, right? The normal one was up. This one's completely down, as if crushed. Okay. Right. See what I mean? So they tried to what? Paralyze you, kill you, whatever. And right. Yeah. We do what? Comparisons. Right. So, you already see what I mean. I know you already see what you mean. But you're gonna turn a blind eye to it if I'm functioning in heaven today. I know you are. That's all I mean. That's all I mean. I understand why. Ain't that either. No.
Important to recognize because they may have chronic neurological deficits associated with them.
Right. So again, you see the Hemans fracture. Right. There. And where? There. Right. That ain't a Higgins fracture. That's a Higgins fracture. Yep. You might say I'm like Jesus too, I guess. I know. And see, it's still what? Shorter too, right. See how it is? Right. And there. See all that? Right in there. There. You see it's the same type fracture. I know it is. Exactly the same. Exactly the same. I know. Exactly. So they're what? It's even up higher, because see, if you hit me over the head, it's going to push it back too, right? And crush this part. And see, right in there. Right. It's called a Hayman's fracture. I know. We just proved it. By simple comparison. And I'm on about it too. He's on about it too. And you see, this is all that's still in alignment. The C1, C2, right? Even that, right? Well, you see how mine is right in here, right? Right in there, right? That's all blowed up too. I told him that too. I know you told him that too. See all this in there, right? See how it's far apart, right? See, right? That's crushed on top of it too, right? See how it's pushed down, right? And all this, right? That's collapsed, right? On itself and pushed back. And this is pushed forward too, right? It's way up here, right? It's not supposed to be way up there. See, either, right? And there's the Hayman's fracture. What does that look like, though? A Hayman's fracture that healed over the years. And see, even here, you see the oddity in how far spaced is the C1 from the C2. Right. Well, mine's closer. Yeah. Right. You see, if you're hit, you're gonna crush that. Because you're also gonna try and go back to avoid being hit in the head, right? So it's gonna crush you down, right? He's trying to hit me over the head. 2 days, 2 days. Eat your heart out, Keanu Reeves. Stephen King. I know. And yours is fictional. Mine's obviously real. I know. 2 days, 2 days. Out the hospital, too. Damn. Right. Well, that's another problem. Finding a woman who's worthy of you. Mm-hmm. So she's... Daphne didn't understand me. Maribel didn't understand me. They just wanted sex, and I gave them good sex, too, now. That ain't a problem either. I know. All right. Like you said. Mm-hmm. Another comparison is the holes in the head. Does that do? Let's see. Let's see. Mm-hmm. Mm-hmm. All right. Remember that? Mm-hmm. Mm-hmm.
Normal film here. You can see that this is well aligned, so the lateral margins of C1 and the lateral margin of C.
See, that's not aligned, right? Mm-hmm. So again, mm-hmm. Right. Right. See? Mm-hmm. Mm-hmm. Well, mm-hmm. 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 Seal. Mm-hmm. We're also talking about can God heal it? well. Mm-hmm. 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 Well, the teeth are kind of in the way a little bit. Mm-hmm. Too, it's a little different view. Mm-hmm. Right. Mm-hmm. But see, this one is the broken one, this one is the normal one, and mine's still thinner, right? You see what I mean? No, it's still thinner. Mm-hmm.
C2 is actually well
See.
aligned. While with a Jefferson fracture, it's not, and you see a
Could also be a Jefferson fracture, right?
On a
Involved,
CT,
I know.
you can see a fracture involving the anterior and...
It's not to get anyone in trouble. This is not to get anyone in trouble. It's just trying to figure out what the hell happened. Mm-hmm. I know. Mm-hmm. So it could be a Jefferson hangman's type fracture, I know. So again, I know. Mm-hmm. This one here is a cervical trauma protocol. Mm-hmm. And again, I know.
fracture can compromise spinal cord integrity. So the first thing that's done is a trauma protocol, which involves a cross-table lateral radiograph of the neck. And this ensures that there's no
And see, this
fracture or
one's in
subluxation of the
alignment,
cervical
right?
spine, prior
Right.
to obtaining further imaging,
First thing I
which may
point
involve
out,
manipulation of the patient's
alignment.
neck.
And, not aligned. Not aligned. Right. See, I pointed that out too. Alignment's necessary, and all that is the damage area, right? This is the C2, C3, where the lot facet is, right? And yet it's also a fracture right in there, right? Called the Hangman's fracture. I know. He's not lying. Nope. And you're stubborn and I know, we're stubborn. We're stubborn as the devil himself. We're following Satan more than God. Way more. It's easier to follow him here too, right? He's quick to judge and send you to hell with him. No, he is. I know. I don't judge you. Even when I'm going out to church with you, I don't judge you.